What's up, everybody? Welcome back to Twisted Life of TV. I'm Poetry. I am out the hospital, child. This is going to be your traveling talk for the week because I am actually not traveling tomorrow. The only reason why I am traveling today is because I have to go get all these fucking prescriptions filled at the VA. This whole stack is my prescriptions. So, and I had to take in a hard copy. They wouldn't accept transfer over from the hospital that I was in. And they would have took fax, but they were closed yesterday, so the doctor couldn't fax it yesterday. So I physically have to go down here and drop off these prescriptions that I should have started taking at 5 a.m. this morning. I drove down here once, got all the way down to the VA facility in the parking lot, and didn't have the prescriptions. I had left them sitting on the table at home. I don't remember leaving them on the table because that was the last thing I picked up before I walked out the door. I couldn't find my keys. So I must have set the papers down when I was looking for my damn keys. Alright, so let me drink some water. Let me first start off by saying this to you. Thank you all for your thoughts and your prayers. I know y'all prayer warriors was out there doing y'all damn thing. Y'all manifestation warriors was out there doing y'all damn thing. And yeah, I really appreciate it. Much gratitude for it. This is probably one of the more scarier moments in my life when it comes to like my health. You know, you have a health scare. Yeah, this was a true scare for me. I've seen a few comments from people telling me that I need to make sure I get some rest. I need to make sure I follow my doctor's orders, I don't have any doctor's orders. I don't have any requirement to rest. The doctor told me I can go back to work today. I chose to take off because I didn't get out the hospital until yesterday evening, and I said I needed to rest. But the doctor says I can go on with life as normal. There is nothing, because y'all know, like, I refuse to take medications and shit like that. There is nothing that I did to trigger this episode. So all the people who are thinking it's because you don't take your this, it's because you don't take your that, it's not that at all. I have a condition that medically they don't know what causes it or what triggers it, and there is no cure for it. The average person, they told me, normally gets it in their 20s. I'm 50. So it's very rare that someone my age actually develops this condition. But somebody in their 20s will grow out of it, is what they're telling me. As far as me being 50, I don't think that I'm going to grow out of it. My problem is that if this type of episode happens again, it could lead me to, because it's causing stress on my heart, it could lead me to heart failure. Now, being that I am obese, reducing my obesity will help reduce the amount of occurrences that I have. Again, I have to basically just treat the symptoms. So the obesity, losing weight will help me reduce the occurrences. I believe also that the fact that I'm no longer in acupuncture, because remember I was doing that helped me, because the whole time I was in acupuncture, I didn't have palpitations. So basically, some of y'all been here a while, y'all have seen my videos, y'all know I get heart palpitations. I complained about this to the VA before. Their diagnosis was that it was stress related. If y'all remember me telling y'all that. That's what their diagnosis was. It was stress related. Talked to my therapist. And even though I explained to them that these situations, these onsets happen when I'm doing nothing. I'm not stressed out. Sometimes I'm just laying down. Sometimes I'm asleep. That's when it'll happen. So it's not that it's stress or overextending myself, but fatigue. They do believe that fatigue can contribute to, the same with obesity, can contribute to the symptoms reoccurring more. And y'all know how tired I be at work, but we're not certain at this particular time if I'm tired because of work or if the palpitations are causing me to be tired. Just for the past week or so, I've been getting them, the past 2 weeks or so, I've been getting them a lot more frequent than I ever have in life, the heart palpitations. Normally, I could take some deep breaths, do some deep breathing, and they would go away. This is the first time I was actually in motion, moving, walking, when the palpitations hit me like this, and I had wooziness, dizziness, fainting accompanied with it. I thought I was having a heart attack, child. Okay, so I'm at work. I'm going up a flight of stairs to a customer's door. He opened the door. I kind of tilted in on him, child. That was my first thing, like, oh, what the fuck is going on? I was like, am I tripping? Am I making up in my head? Is this really happening? That's what all the thoughts that was going on in my head at that particular time. My damn earring kicked in. All that stuff was going on in my head at the time. I handled my business with them. I sat down outside the apartment for a minute, about not even a minute, maybe 30 seconds or less. I sat down, and then I felt fine. So I got up, went back to my vehicle, went on along my way. I went to my next client's house, and same thing happened, because they were on the second floor as well. Went up the flight of stairs, and I felt woozy. I felt like the world was shaking and moving, and I wasn't. I said, something ain't right. Sat down for a spell again. Actually, I didn't sit down. I leaned up against the wall for a spell, and I seemed to be okay. I wasn't feeling any pain, but then I started feeling the palpitations. And it felt like, if you ever had palpitations before, it feels like, this is the way I describe it, birds fluttering in my chest. Like their wings are flapping in my chest. And the doctors described to me that that's because on the heart there's valves, and the valves open and close. Basically, my valves at the top of my chest are opening and closing really fast, which is why I can feel the palpitations in the wind. Because like they keep telling me, asking me that I have shortness of breath. I didn't have shortness of breath. I felt like I had too much air in my body, because I could feel that fluttering. Okay, so that's what was going on. But after leaning up against that wall for a moment, I got myself back together and went down back to my vehicle, and I'm going to my next place. Going to the next place, walked in, and I was like, something don't feel right. You know, that's what I just kept saying. I was talking to the girl, and she was like, you want some water or something? And I was like, no, I don't need no water. Something ain't right. You know what I'm saying? I'm trying to do my deep breathing, and it ain't working. That's usually when I get the palpitations, I do the deep breathing, and it ain't working. And there's a CVS next to where I was at, and I go in there often, like daily really with them. So I walk in, and I see the doctor that be in the back, in the minute clinic in the back, and I was like, hey, I think I need some help. And she was like, hey girl, what's up, what you doing, what's going on? I said, I think I'm having a heart attack. And she's like, okay, come on in my office, right? Check you out. So she took me back there. And as soon as I got in her doorway, I remember falling. Next thing I know, I was sitting in her chair, okay? She had the blood pressure medicine on me, the blood pressure machine on me. They was checking my pulse. My pulse was reading over 300 beats a minute. That's how fast my heart was going. The normal heart rate, if you don't know, is around 72. Most athletes, their heart rate may be around 64, but I was at over 300. My blood pressure was rated at 225 over 100 and something. I want to say 190. It was super fucking high. So, of course, I think I'm having a heart attack. They called 911. EMT showed up. They gave me IV. I still got all the marks and bruises and the tape and shit still on my arm. I can't wash it off for some fucking reason. So I'm doing all that with the EMTs, answering all their questions, and he's telling me I got SVT, subventricular tachycardia, irregular heartbeats, basically. He said my SVT was at 175 or something by the time that they got there. My pulse, my beats, my heartbeats and everything, it's about 175 when they got there, which is still high as fuck, right? So they gave me some medicine to bring that down. Well, the medicine did the opposite. When they gave me that medicine, it shot back up, but it went up to 274. So I wasn't over 300 no more, but I was at 274. So they gave me a little drip of something. I don't remember what it was called. to bring it back down. So they got it back down to 175 by the time I got to the hospital. The way he explained it to me, I think I tried to explain it. I said 4 beats a minute and 1 beat a minute. The top of my heart, like there's valves at the top, there's valves at the bottom. The top of my heart was beating 4 times faster than the bottom of my heart. So for every 4 beats, the top was doing 1, the bottom was doing 1. But again, I was beating at 175 beats a minute. It's only 60 seconds in a minute, and I got 175 beats going faster, you know, than the actual heartbeat going. So, but he told me it was indeed not a heart attack. So I went from SVT to AFib and a flutter. I was showing symptoms of both. I had the sweats, I had the wooziness, I had the heart flutterizations, the irregular beats going at the same damn time. But I was lucid. I knew where I was at. I could hold a conversation. I think I was even cracking jokes. You know, sometimes you got to make yourself laugh to make you feel good. Sometimes laughter is the best medicine. So I know I be in there cracking jokes and ragging on myself at times. And, you know, trying to get everybody calm, because I'm trying to make myself calm and stay calm. So I'm trying to make sure everybody else around me calm too. Because if they, you know, are acting in the way of panic, I'm a panic. And the guy was like, I told him, I say, the reason why my heart probably beating as fast as it is because I think I'm having a heart attack. So I'm probably making it worse by assuming I'm having a heart attack. And he was like, no, you're not having a heart attack. So I get to the hospital. I didn't know where the fuck I was at, but I know I was in the hospital. This is one of the nicest hospitals I've ever been in my entire life. Now, I had just got done eating. I had just finished lunch. I was in the middle of my workday. Majority of my workload was still in the vehicle, which I had to leave on the parking lot of that CVS and leave the keys inside the vehicle so people at my office can come get the vehicle and get to work. My car was still parked at work on the parking lot. So, in this ER, we're doing all these tests, we're doing the blood work. I got to pee, child. I had to pee when all this situation happened. Normally, the third office that I went into, before I went over to the CVS, that's normally where I would go use the bathroom in the middle of my work day. But I didn't do that because I was feeling something kind of weird. So when I went over to the CVS, I said, you know what, I'm going to go ahead and use the bathroom over here while the doctor, while I wait to see what the doctor going to do with me. But then that's when I passed out, so I still didn't use the bathroom. And so I'm at the ER now, got to pee like crazy. But I can't pee because they may need my pee to test for other stuff, right? So they did a finger test on me. And I'm trying to tell the lady, I just ate. I mean, like, just ate. Everything happened within a 10-minute window of me had just finished eating. My glucose was high as fuck, child. It was 318. Glucose is how you measure whether you got diabetes or not. So, because my glucose is 318, they decided to do an A1C test on me. Now, usually when you do an A1C test, they want you to fast and stuff like that, but an A1C test basically covers over a 3-month period of time. My A1C was high. Now, this is what's been happening with me with my glucose out lately. My stick tests have been ranging from normal to high. It's been fluctuating very greatly. But even when my stick test was low, my A1C was still high. So that's why they was always calling me a pre-diabetic at first, because my stick test was normal, just the A1C wasn't. But now it's because of how high the A1C was, they was like, yo, you need to be on insulin. So they started giving me insulin shots, child. And now I got to give myself insulin shots in my belly. Even though since I left the hospital, my stick test is still showing 91, which is normal sometimes. Because late at night, it went to 253. And I was trying to explain to these doctors that I'm an anomaly. People don't believe you when you tell you that shit. I say I'm an anomaly. Things that normally happen to people when they take medications, the opposite happens to me. If you're going to give me some medicine to bring down my blood pressure, because my blood pressure high, it's shooting my blood pressure up. You give me medicine to control my glucose, it's shooting my glucose up when it's supposed to be lowering it. So if my glucose was a normal range and then you gave me an insulin shot and it went up, something ain't right with that. Why is my air not kicking on? Again. It's the second time I done got in this car and did this. So anyhow, I got through the ER hella quick, y'all. They got me through there real quick. And they put me in the ICU. But they put me in the PICU, or the PCU, which is the Progressive Care Unit. Basically, the Progressive Care Unit means that you're stable. You had a situation happen, a heart attack or a stroke, but you're now stabled out. I may not be at normal ranges, but I'm stable for whatever range that I'm at, right? So that's what they put me at. I had so many damn wires and tubes hooked up to me. I can't even get the tape marks off my doggone body. I got so many doggone stick marks into me. And the first girl, you know, I'm still like, I gotta pee. You know, can I pee? They told me they was gonna bring me a little pill to let me go ahead and pee, and it evaporated up off me. I said, ma'am, I'm not gonna pee on myself. I'm a grown ass woman. I'm not gonna pee on myself. So she was like, we can bring you a bed urinal. Fine, you can bring me a bed urinal. I'll pee in it, but I gotta pee. Okay. Now, mind you, I'm still dealing with the heavy bleed. So now not only am I gonna have the urine, I'm gonna have the blood, everything gonna be there, child. And I am burning up. Why is my air not kicking on? You might hear my air conditioner. Apologies. Anywho. So the first urine sample that they allowed me to take was filled with blood. It was so full of blood, it was purple. That's how full it was. It came out purple looking in the damn cup. And the lady was like, you on your cycle? I was like, yes, I told y'all that. They wasn't listening, child. And they kept asking me over and over again when it was the first day of my cycle. And I'm telling them the first day, and it was months ago, because, you know, how my cycle go. I told you I bleed for long periods of time. And they like, no, the first day of it. I said, I just told you the first day of it. She said, but you on right now? I know. And I said, so I had to pull out my damn app calendar to show them this is how my cycle is. If you look at this year, I've had a total of 4 weeks out the entire year so far in which I have not had a cycle. That's how my body works, bam, okay? So, of course, I'm anemic again. Now, remember last time I told you that the doctor was like, what's up with your thyroid? You got thyroid problems? And I'm like, I ain't got no damn thyroid problems. They tested my blood and everything again. I don't have thyroid problems, okay? So, all through the night, though, it kept going up from like 175 to 190 something, my heartbeat. But like they had stabilized around 175, so they put me in this progressive care unit. And then they started giving me beta blockers to help control the rhythm of my heartbeat. The beta blocker was supposed to also help control my blood pressure. And it made my blood pressure high. My blood pressure is high at 140 over something, you know, it's my baseline, but it's still high for a healthy person. But that's my baseline. So it's starting at 140 something, it shoots up to 190 something. And then in a couple hours, it's back down to 140 something. They're like, see, the medicine working. No, ma'am, the medicine is not working. It's not. Because I started at 140 when you gave me the damn pill, and now it went up and then it shot back down. You can't tell me that it's working if it's clearly back at the baseline that I was already at, which actually wasn't helped in the first place. Anywho, at some point on Saturday, my heartbeat's regulated to around 100. And they got me to do an echogram, an EKG, a stress test. But for some reason, this particular hospital wants me to go inside of a machine. It's like an MRI machine, but it's not. It's not as loud, not as big, but it's the same thing. Your full body is in this little bitty ass circle. Y'all know I got claustrophobia, and I've told them before, I can't do that shit. Now, it should have been in my medical records that in order for me to do any type of thing like this, they have to sedate me. Usually sedation medicine, they had to give it to me 24 hours a day. They wouldn't hear me. They didn't believe me. They thinking that, you know, I don't know why motherfuckers don't listen to you when you talk. I'm telling them I cannot go in this fucking machine, right? So they do the regular imaging. I'm already, you know, kind of panicking just because I was close to the hole. And then they kept trying to push me in this machine. I almost broke the machine. And so they took me out, they sent me out to do my stress test. They said, we ain't gonna worry about that part. You only gotta be in there 30 seconds. I don't give a fuck. I'm not gonna be in there 1 second, okay? I don't wanna feel like I'm being buried alive, and that's what that machine makes me feel like. It's like, well, maybe you plug your ears so you can hear it and you come up. know, no. I know when the air around me has started to thin. And if you put me into a tightly closed space, the air around me thins. Like, I can't even get facials good if the damn esthetician get too close to my face because I can't fucking breathe. Okay? So I know what it's like, whether I'm looking when my eyes are closed or not. I know what it is when I'm inside or if I'm trying to go inside in the closed space. The air feels different around you, okay? But they wasn't hearing me. Anywho, I go off to go get my stress test and my EKG and all that other junk done, right? So I get in here, you know, like I said, I'm obese, but I used to be a runner. I don't run no more because, you know, back problems, leg problems, everything. Weight. I don't run like I used to. It could damage my knees, fuck my knees up. I mean, running me is fat, so I can do some fast walking, which is the most healthiest thing for me, or riding a bike is another healthy thing for me, rowing, you know, something like that. So anyhow, this urge still ain't kicked in, child. This bugged me. Why the fuck this urge ain't kicked in? This is another expense I do not fucking need. And urge ain't kicking in. Anywho, I get in there. The nurse is like, have you ever got on a treadmill before? I'm like, yeah, I've been on a treadmill. I used to be a runner. I used to run marathons, so I've tried. You know what I'm saying? I know how to work out. Well, this is going to be unlike anything else that you ever done. I say, ma'am, I've done stress tests 5 times. I've done told y'all before, I've been dealing with these heart palpitations for a couple of years. I've done stress tests. I know what they are. They hook my ass up to a machine, and they make me fucking run. Which is why I didn't understand why the fuck I couldn't eat. They hadn't fed me either. So I got to the ER. I couldn't fucking eat. I'm hungry as shit. Hadn't ate since I had lunch. That Friday, right? It's Saturday now. I'm hungry. And I'm weak and woozy because I'm hungry. So she was like, I can tell you still having heart palpitations because of the way you walk. And I say, no, motherfucker, I'm starving. This is called hunger. When you're hungry and dehydrated, you tend to, you know, feel a little lethargic, you know, a little weak in the knees. That's what I'm feeling right now. Because they wouldn't allow me to drink water either. So from the time I got there to the ER at 3:30, and this is now the next day at 1 something, almost 24 hours later, I had no food, no water. I'm lethargic and hungry and thirsty. You know what I'm saying? So this is killing me that this air ain't kicking in, y'all. This is Florida. I gotta have air conditioning. I have this air kicking in. It's blowing hot air. It's just blowing hot air. Anywho, so she's going through all this little explanation, right? And then she was like, well, we're gonna turn the incline up every 3 minutes, and we're gonna speed it up every 3 minutes. Just let you know that. I say, I understand. I told you I've done this before. I say, it's no worry. I say, and I keep telling y'all, my lip filler. I keep telling y'all that I normally don't have palpitations when I'm in movie. Like, every time they've done a stress test on me, I don't get the palpitations. The fact that I had palpitations today or yesterday while I was walking up a flight of stairs, that's out of my norm. My normal baseline is that I do not have palpitations when I'm exercising. But again, they ain't trying to hear me. So I'm on this machine. They got me and 2 other patients in the room. We're all on the machine together. First patient dropped out after 30 seconds. Next patient, she made it 2 minutes and some odd seconds. I completed the whole test. I didn't break a sweat. My heart didn't beat extremely fast. Nothing. Nothing happened. Again, I started at 100 beats per minute. And I still didn't really go over, but I went to 146 is what they told me. They wanted me to reach 144. I went to 146. And I completed the entire thing with no pain. And I kept telling them I didn't have any pain. What I had was a feeling of fluttering in my chest. I could feel the wind in my chest. That's what I could feel. I wasn't having pain. Even when I got dizzy, I wasn't in pain. And that was the first time in all the time that I've been dealing with palpitations that I've gotten dizzy when moving. You know what I'm saying? So, I passed my stress test. They did my echo test, my EKG test. I don't have any heart plaque, you guys. I don't have any blocked arteries, okay? I don't have, my heart looked normal except for one small spot. There was a small enlargement on the left side of my heart. But she said it wasn't nothing for me to worry about. The small enlargement was not causing what I was going through that day. Okay? And he reiterated again, we have no understanding of why this happens. But we do know that if I do control my weight, I do walk often, I do eat all the shit I normally eat, lentils and rice and beans. If I still eat the stuff I normally eat, green leafy vegetables, I eat that all the time. That can help reduce how often I get these palpitations. Not cure them, not make them go away, but help reduce them. Resting, it ain't really doing nothing for me, even though I want to rest because I feel tired because I've been doing 10-hour work days. I want to rest. But that's not really doing anything specifically for these palpitations because they happen for me the most when I'm at rest. Exercise, they want me to keep up with exercise at least 30 minutes a day. You know what I'm saying? Everything that I have been trying to do, but have been doing more consistently over the past few weeks. So yeah, I had issues with the nursing staff. I became patient-zilla after a while, child, especially when I couldn't eat. But I told them in the beginning, I turn into a fucking bear when I don't eat, and I'm serious. Oh, sheesh. I'm trying to give y'all advance warning. Oh, so after I got done with my EKG and my stress test and everything, they tried to send me back over to that machine to do it all over again. And I keep telling this lady, I'm not getting in the machine. They get the images. The first 15 minutes, they get those images. But that last 30 seconds when they stick my whole body in the machine, like I'm being in a fucking coffin, that ain't gonna work. And I'm telling her that's not gonna happen, right? So, it's not doing nothing. This air ain't kicking on. I'm just making noise right now. I'm telling her ma'am, it's not gonna happen. So they try to give me a Xanax. Or Xanax, something like that. X8NAX. Try to give me that. Tell me, girl, it's gonna make you feel real good. I don't say I'm not a dope head. I don't use substances to try to make me feel better. It ain't gonna make me feel real good, okay? I don't like being loopy and out of control of my mind or my body. It's not a good feeling for me, right? But anywho, it had no effect on me. And she was like, how you feeling? I said, I feel the same way I did before you gave it to me. She said, well, this is supposed to help relax you, right? So I'm getting up out the wheelchair and getting back on the machine. She's saying, see, you already relaxed. Look how slow you moving. I said, girl, my foot hurt. That's why I'm moving slow. I got plantar fasciitis. My foot been hurting for about a week now. Shit. That's why I'm moving slow. I was moving slow before I came in here. It's the same speed I was moving before I came in here, before y'all gave me that damn pill. The pill ain't did shit for me, okay? But it's gonna make you sleep better. No, it's not. I say Benadryl don't make me sleepy. Sleeping pills, Ambien, whatever, it don't make me sleepy. Because my body naturally fights against the feeling because I'm trying to figure out what the actual medicine is doing. What is it doing? What is it doing? I'm trying to figure out what the actual medicine is doing. So, I don't know, for some reason, trained myself over my lifetime to fight against sleepy medicine, NyQuil. Don't put me to sleep. None of this stuff puts me to sleep because my body wants to know what the fuck the medicine is doing as far as like the cold or what have you, right? So anywho, they gave me this Xanax, tried to put me back in the machine. Same reaction. I said, ma'am, I can tell y'all, it's not, my heart does not need calming to get in this machine. I don't need to be doped up to get, you have to completely sedate me, like knock me the fuck out. And or I'm not getting to this machine. Plain and simple. It's my mental. I have claustrophobia. I have PTSD. And being in tight and closed spaces triggers that. That's what gives me the anxiety that makes me not get into this fucking machine. But they still want to try to hear me. They put an order in for me to do it again. I said I would fucking not. Now I'm arguing with motherfucker. I said, what the fuck do y'all not listen to? What no means no, bitch. I've already told you no 5 fucking times. No. Same thing, they want to give me blood thinners. Because I'm on beta blockers, they said that I needed blood thinners. The blood thinners is going to make my bleeding worse. I'm already bleeding daily. The doctor already told me that I'm fucking anemic because of how much I'm bleeding. And now you want to give me blood thinners to thin me out more. No, we're not going to do that. We're going to figure out a way to get around potential blood clots another way. Like, I don't understand why, one, you're giving me beta blockers, so to speak, to help my heart, but the beta blockers can cause blood clots around my heart. That's why I don't like medicines, because they give you one shits that make another problem. They give you one thing to try to cure one thing, and it creates another problem. So I'm taking this shit for my heartbeats to regulate, so they can control the speed that my heart is beating, but it can cause me blood clots around my heart. You know what I'm saying? This is some crazy shit. Anyway, I'm taking that. I'm taking that until I can get myself back into a healthy pattern of exercise, and where I can maintain my own, get my heart rates back at a normal level on its own. So I will be taking that, but I'm not taking the blood thinners. I bleed too much. I go through, you know, I always had those 10-hour overnight pads. I go through them every 2 hours. It was actually probably every hour for real. But I'm changing on, I know, at least every 2 hours at the least, I'm changing them. A 10-hour. Wait, this motherfucker just rolled up on the back of me. Y'all see him in the back there. A 10-hour pad. He ain't looking, that's what they ain't doing. A 10-hour pad I'm going through. I go through, on average, maybe 10 pads a day. Maybe more. Just at work, then at an 10-hour period at work, I'm using at least 5 or 6 pads. One's supposed to do the 10-hour whole overnight, but yeah. But anywho, after running test, they were sticking my black ass every fucking hour. I got so many needle holes in this damn finger. I got so many needle holes in the back of my arm. They sticking my ass every fucking hour. After running blood test after blood test, work after work, echos and ultrasounds and all this stuff, finding nothing directly wrong with my heart other than the irregular beating, the AFib, and the A-flutter. They finally said, okay, fine, we're going to send you home. You know what I'm saying? You done stabilized out around 85 now. My heart beats around 85 right now. But they gave me this stack of prescriptions. Well, the hospital did not take the VA as far as being able to cover the prescriptions. So we was going to send them out to CVS, because CVS is actually, I've already got prescriptions filled at CVS before. But I didn't know that CVS, the Veterans Hospital, only covers a 14-day supply, which is the only thing I've ever got for CVS. Probably been antibiotics. So I can see that why I didn't have more than a 14-day supply, so I didn't know that they was only going to cover a 14-day supply. So I had to, like I said, get hard copies to bring it here to the VA. That's where I'm at right now in the VA hospital. Come on, go. I don't know what the fuck he doing. To the VA hospital. Where's my badge? And so the doctor had to try to trick, I guess, the insurance or what have you. And they were supposed to be discharged just there around 2 something. No, around 12 something. How you doing? And I didn't end up getting discharged like 6 o'clock last night because I couldn't get my medication prescriptions filled yesterday because the VA was closed on Sundays, and CVS wouldn't give me just a 14-day supply because they said I would have to have the whole prescription written all over again for the rest of it. So he kept me there till late at night so they could actually pretend that I was still in the hospital and give me another dose of medicine, which worked for last night, but it didn't work for this morning because I needed my first dose at 5 a.m. And the VA, the pharmacy didn't open up till 8 a.m. And like I said, we came down here, and I had my daughter with me when I first came because I was concerned about me driving, and I didn't want shit to happen while I'm driving. But, so when I first came, and I didn't have a fucking prescription, so I'm back again. And it's now 10:42 a.m. I should be on my second dose. I haven't even got the prescriptions filled yet, child. Haven't even got them filled yet. But like I said, there is nothing that they could do to prevent it from happening again. If I was to have an SVT again, I could possibly get an ablation done on that area. But since it turned into a AFib and A-flutter, the SVT ablation won't help. Damn, he got a good parking spot. It won't help. So, one, I was like, I kept saying I just need to lose weight, right? And he was like, yeah, you can lose weight, but that doesn't mean it's going to help. It's not going to make the condition go away, is what he said. Even with me losing weight, it doesn't make the condition go away. It just helps. So, I got to help it out. So, I'm up here at the VA trying to get these prescriptions filled. Hopefully, I can see somebody about my blood pressure cuff, because my cuff keep malfunctioning. And according to my cuff, I got good readings. Every time I come to the hospital, in addition to the fact that I have white coat anxiety, every time I come to the hospitals, it be off the chain. The readings be off the meter. You know what I'm saying? They be ridiculous. Damn, ain't no parking on this floor. What the fuck? Drive back around and see if I can see anything. There was a man. It looked like he was trying to pull out down here earlier. Is that him? Did he just pull out? It's usually the light turn green when the car pull out. Yeah, okay. So I found me a parking spot. Going here. Now my doctor, I was supposed to have a VA appointment the other day with my doctor who I've never met. So they got another new doctor. I told you they change doctors. Every fucking blue moon they change doctors. And they canceled the appointment on me. So I haven't met this doctor, so now I'm gonna have to meet this new fucking doctor, right? Because I gotta do a follow-up with them in 2 weeks. I gotta do a follow-up with the cardiologist at the new place I went to in 2 weeks. But technically I could be at work today. I chose to take off. Well, actually my boss said that she had already took me off the schedule for the day. And I'm off on Wednesday, so I just took off for tomorrow too. I'm just gonna make myself rest. And then I'll go back to work on Thursday. And I just gotta be mindful of what the fuck I'm doing in life, you know. Try to keep these beta blockers going and help control the pace of everything. And that's about it, y'all. That's been my whole experience. I'm at the VA hospital. Let me go ahead and get these prescriptions filled, and I'll talk to y'all in another video. Peace. So it's 2 p.m. I am just now getting this prescription filled. I have a fucking grocery bags of shit. No instruction. Well, some of the stuff is self-explanatory how to use it, but I've basically missed 2 doses of medicine already because I've been sitting here waiting to get it filled. Normally the VA takes about 45 minutes to fill medications, but I've been here, I think I got here 11 something. I said it at the beginning of this video, I don't remember, but it's now 2:04 p.m. and I'm just now leaving out of here with the medications. Got me a new blood pressure machine too, though. They did give me a new one of those. So, my doctor, my primary doctor, I'm supposed to have a follow-up with her. But they don't have any availability until January. So, I'm going to talk to her by phone next week. I'm trying to see, like, if any of this stuff is required to go in a refrigerator. Yeah. Refrigerate until first use. Huh? After first use, then store at room temperature. Refrigerate at 2 degrees until first use. After first use, store at room temperature and discard after 28 days. So do I need to go keep it in? I need to keep it in the refrigerator till I open it, is what they're saying. Where's my glasses at, y'all? Let me get off this camera. I'll see y'all when I get home.